Malindi Sub-County Hospital in Kilifi County have come up with an innovation that will help reduce postpartum hemorrhage among women. This condition causes a woman to lose more than 500 milliliters of blood and is the leading cause of maternal deaths and morbidity in the world. Our reporter Elizabeth Atieno now reports on this new innovation dubbed GOtv that seeks to reduce deaths emanating from postpartum hemorrhage by 60%.
At the Malindi Sub-County Hospital, we head straight to the maternity and labor ward. Hundreds of expectant women are in the waiting area. This is a high-volume medical facility that serves 3 counties including Kilifi, Tana River and Lamu, and it is estimated that between 80 and 100 women give birth in the facility every week. Unfortunately, 6% develop postpartum hemorrhage, which occurs when a woman experiences heavy bleeding within 24 hours after giving birth. In a bid to curb this menace, the hospital has come up with a reusable graduated drip made of plastic bags or Macintosh and a blood collecting container placed under the bed. This is aimed at preventing postpartum hemorrhage, which accounts for 34% of 5,000 maternal deaths reported annually in Kenya.
This treatment, which is using the drape to accurately diagnose postpartum hemorrhage and then using the bundle of treatment, reduce the number of women who bleed a liter or more of blood by an incredible 60%. So huge effect was seen.
The innovative drip is spread on the bed and the patient sleeps on it. It has strings that are tied around the patient's waist to avoid it slipping out when there is bleeding. The blood then flows down to the bowl, marked in milliliters. The milliliters range from 100 to 500 milliliters, and when the blood surpasses the 300 milliliter mark, then medication is administered to the patient.
So initially we'd have to struggle with trying to look for blood to transfuse these women. Some needed who had developed acute renal issues had to be dialyzed, and some needed ICU care, and some were lost. So now we've seen a reduction in that. We are transfusing less mothers because now we can quickly manage postpartum hemorrhage in good time. We are not having a lot of morbidity from surgeries that we used to do for these mothers, and we are having less women being dialyzed. And we are also grateful for the fact that we have the quality drugs that we need to use to manage these patients in terms of oxytocin and tranexamic acid. So those are some of the things which we would like to have a continuous supply of from the Ministry of Health, KEMSA, the counties, so that we can always manage postpartum hemorrhage in a way that there is continuity and we stop discussing it as one of the major killers of women in our area.
A woman has lost too much blood on that accurate measurement, then we give a bundle of treatment called GOtv, and that has got drugs in it like oxytocin, like tranexamic acid, but also other steps which would improve the outcome for the patient.
Dr. Maureen Were, who is a lead gynecologist at the Malindi Sub-County Hospital, led a team of nurses to develop the gadget after a 1-year pilot project conducted using the GOtv technology, which involves over 200,000 women in 4 African countries, including Kenya, Nigeria, Tanzania, and South Africa.
So the uptake has been really good. We've gotten good reception for the patients. And the other thing is that it's clean. There's no blood going everywhere. So the mother feels like she's clean. The blood is not soaking around her.
We were leading the activities of this trial from the University of Nairobi hub, and we had several facilities participating, a total of 19. And then the last part of the trial, we had 7 facilities that were carrying out the intervention.
During the pilot study, a non-reusable graduated drip was provided by the Bill and Melinda Gates Foundation at a cost of $2. Hence, the Malindi Sub-County Hospital opted to innovate one that is reusable.
It has come down in cost already to about $1.5.
Kina mama takriban 6,000 wamepata kupitia hii initiative, na wale wamama wamefaidika kwa sababu outcome imekuwa ni nzuri. matokeo yamekuwa ni mazuri.
A call has been made to the Ministry of Health to provide the emotive technology to various health facilities across the country so as to prevent postpartum hemorrhage.
We are really looking forward now to have the findings of this study being translated into guidelines, starting from the World Health Organization, coming down to countries and Ministry of Health. And there's also a component of quality of medicines, which we hope to take up again with the Ministry of Health, Pharmacy and Poisons Board and KEMSA, so that we have drugs that are going to be of quality.
Statistics from the World Health Organization indicate that 14 million women across the globe experience postpartum hemorrhage and that 70,000 women die due to excessive bleeding every year. Elizabeth Atieno, TV 47.